In this video, I'm going to show you step-by-step how to use kinesiology tape for leg lymphedema to reduce your swelling. I'm Dr. Alex Hill. I'm a board-certified oncology physical therapist and a certified lymphedema therapist. Let's get taping. Lymphedema is a chronic condition characterized by a buildup of lymph fluid that causes swelling. It often occurs because of damage to the lymphatic system. This can happen after cancer treatments like surgery or radiation therapy, or if you've had other trauma or infections in the affected area, like your legs. Now, let's talk about how kinesiology tape can actually help to manage leg lymphedema. Kinesiology tape is a stretchy adhesive tape that can be applied to the skin in various patterns. It works by lifting the skin slightly, which creates space for better lymphatic drainage for the fluid to get back into the system. It works best with movement, so stay active, move your legs, and if you need exercises for leg swelling to use with the K-tape, make sure that you check out my video above or in the description for exercises that you can do. Before using kinesiology tape for leg lymphedema, consult with a lymphedema therapist or your healthcare provider. They'll make sure that they assess your specific condition and determine if kinesiology tape is appropriate for you and what the best application method is. When using kinesiology tape, it's important to remember a few key points. First, the skin should be clean and dry before you apply the tape to ensure proper adhesion. The tape will not stick to your skin if there's lotion or cream or oil on it. You also don't want to put the tape over any open areas like wounds or cuts, and you also don't want to place it over any areas of active malignancy. Second, cut a small piece of kinesiology tape and place it on the skin in the swollen area to make sure that you don't have any allergic or irritative skin reactions. Most people tolerate kinesiology tape well because it's used very gently for lymphedema, but it's always best to check your skin first with a small test strip. Third, kinesiology tape should be worn for just a few days before you replace it, but if you notice skin irritation, swelling, discomfort, don't wait, remove it immediately. Once you remove the kinesiology tape after a couple days, always check to make sure that you don't have any skin irritation, even if you've been using the kinesiology tape for a while. And finally, kinesiology tape can be a valuable addition to a comprehensive lymphedema treatment plan, which can also include manual lymphatic drainage, compression and compression garments, exercise, and skincare. It really shouldn't be used all on its own. All right, all you need is a roll of kinesiology tape and scissors. The tape that I'm using is coming on a roll. It is not pre-cut. However, you can get tape that's already pre-cut into the fan pattern that we're going to be doing while we cut along those lines. So if you want to save yourself some time, you can get it pre-cut. I have both the rolls and the pre-cut types available at my Amazon storefront. Step 1 is to clean and dry the skin. Step 2 is measure and cut the tape. You want to measure the length of tape that you're going to need for the leg, and you're going to need 4 pieces total. 2 for the top of the leg at the thigh, and 2 for the lower part of the leg at the calf and the shin. You're going to round the corners of one end of the tape so that the tape doesn't get pulled up as easily. Then you'll cut strips along the tape, leaving about an inch uncut because that will be our anchor where we want to move the fluid to. You should have about 4 or 5 strips. You can always cut down the middle and then each of those cut in half, or you can cut along the dotted lines that are already on your tape if you have that type of tape. Step 3 is applying the anchor. You're going to apply the anchor by ripping off the paper just at the anchor, and you're going to place it up at the groin and then rub it to activate the adhesive. Remember, the anchor is the point where we're moving that fluid to. Next, we're going to apply the fan strips. So from the anchor strip, you're going to apply the fan strips of tape outward, creating a fan-like pattern. You're going to peel the tape until you get to the end, and then you're going to keep the paper on so that you're not touching the adhesive part. This just helps to make sure that it stays sticky and adheres well. These strips should cover the entire affected area, and the tape should be applied with a slight stretch, really only 10 to 20%. What I like to do is pull it 100% and then 50%, 25%, and then back off a little bit more just to make sure that you're not getting too much tension. That can irritate the skin more. So again, it should be a very gentle pull as you place it on the skin and then rub each of the strips on the skin. Next, we're going to do the back and the outer part of the thigh. You'll rip off the paper for the anchor and place it at the outer part of the thigh and rub to activate the adhesive. Next, just like we did for the first one, we're going to peel back each strip one at a time, hold it at the paper, and then you're going to gently give just that 10 to 20% of stretch on each of those strips. You're going to make sure that you cover the entire part of the thigh that wasn't covered with the first fan. That's going to include the sides and the back, and it is totally okay and encouraged to overlap those strips. Now it's time to do the lower leg. You're going to take one of your shorter pieces, take the anchor and place it either above or below the knee, whichever is more comfortable for you. I prefer to pull it above the knee because then you're going to get a little bit more overlap, but again, do what's comfortable for you. If bending the knee with that tape irritates it, just start the anchor below the knee. Just like with the fans at the top of the leg, for the bottom part leg, we're going to again take each of those fan strips, peel the paper so you're holding it at the end, pull it just very gently 10 to 20%, and then you're going to place those fan strips one by one around the lower part of the leg. All right, now we are on the last piece of tape for the leg, and it's going to go on the outside part of the leg, mirroring what you did on the inside. So again, either place that anchor above or below the knee. Go ahead and pull the paper down to the end of each strip, pull it 10 to 20%, and then place it throughout that lower leg so that the whole lower leg is covered. Again, it's okay and encouraged to have those fan strips cross over each other to give you more of an oomph. Now, if you don't have any swelling in the opposite leg or in the same side of the arm that you have the swelling in the leg in, you don't have any issues with the lymph nodes or the lymph vessels at that opposite groin or the same side armpit, then we can also do this fan pattern across the lower abdomen and trunk to help move it out of that affected area. We can also do the fan pattern up the side, going up to the armpit. That helps to decongest and move that fluid out of that affected leg, that affected lower abdominal area, and move it to areas that can take up that fluid. If you do have swelling in both legs, then you're only going to move the fluid up to that side, so you're only going to do the strip of fan pattern going up to the armpit. So just like we did for the leg, for each of the fan patterns, we're going to cut a long strip of kinesiology tape. We're going to round the edges, cut the strips into a fan, round the edges of each of those strips as well. Place the anchor right below the armpit, and then you're going to pull those strips downward to the groin because we want to move that fluid up to the armpit. If you don't have any swelling in the opposite leg or in that lower abdominal area, then you're going to cut the anchor and the fan strips. You're going to place the anchor at the opposite groin, and you're going to pull those fan strips over to the affected area. So again, we want to move that fluid out from the affected side over to the unaffected side. And there you have it. So we've taped the whole front and back of the entire leg. We've taped the trunk and the abdomen to help move that fluid out. Once you're ready to remove it after a couple days, do it very gently and carefully. Give some tension to the skin as you gently pull it up, and you can also use coconut oil or olive oil or even hair conditioner, massage it into the tape and leave that on for a couple minutes to make it easier to take it off because that adhesive has loosened up a little bit. If you found this video helpful, please give it a thumbs up and share it with others who might benefit from this information on how to use kinesiology tape to decrease the swelling in their legs from lymphedema. Make sure to subscribe to my channel for even more content on how to manage your lymphedema.